think that this is a positive development, and I would certainly consider it an answer to prayer.
A Fort Worth doctor and a humanitarian aid worker infected with Ebola headed home to America for treatment, but transporting them half the world away will be both dangerous and delicate.
A patient with Ebola virus infection has never been cared for in an institution in the United States.
The news leader, broadcasting for all North Texas. Fox 4 News starts now.
It is hard to overstate the significance of this event. The first cases coming to U.S. soil of the deadly Ebola virus. Hello, everybody. I'm Heather Hayes.
I'm Clarice Tinsley. It's 9 o'clock. The Fort Worth doctor, that's one of the two patients, has many people here in North Texas praying for him. Fox 4's Phil Alvarado and Brandon Todd are covering the travel treatment and outpouring of support for the aid workers. We begin with Phil.
Clarice, a special medical isolation unit is waiting for these two Americans when they arrive in Atlanta. Doctors at the Emory University Hospital say that the two are critical, but that they're stable enough to be moved. It's not clear yet who will arrive first yet, but the first one will be here sometime this weekend, the other a few days later.
We have two individuals who are critically ill, and we feel that we owe them the right to receive the best medical care which is available for them.
Reason enough, the doctor says, to take the two Americans out of West Africa, where the Ebola epidemic has killed 700 people.
A patient with Ebola virus infection has never been cared for in an institution in the United States.
Emory University Medical Center in Atlanta is capable of containing the Ebola virus, which has no known vaccine or cure. Fort Worth Dr. Kent Brantley and fellow humanitarian aid worker Nancy Wrightbowl are being flown out individually. Their transport is a specially outfitted jet with containment equipment to handle an infectious disease. The Defense Department says the patients will first be brought to Dobbins Air Force Base in Marietta, Georgia, then transferred to the Atlanta hospital.
We just have to keep the patient alive long enough in order for the body to control this infection.
If Ebola has never been in the U.S., how safe is everyone else?
We have control over everything coming out of the unit. We autoclave all the waste that comes out. We have special air handling.
Dr. Paul Pepe, the Director of Emergency Medical Services for the City of Dallas and a professor of public health at UT Southwestern, says Ebola is spread by direct contact with body fluids or blood from an infected person.
That's the same thing as AIDS or hepatitis C, and so we're used to those things. We do this day-to-day basis, so we're pretty competent at taking care of some of these things. It's just that this gets ranked up a little higher because it has the immediate outcomes of killing a lot of people.
If Brantley and Wrightbowl have any chance at all, it's to come home.
They're people from our country. We're trying to bring them back to our country, and we'll try to give them the best care possible, is how I look at this, and I think that's appropriate. We're getting them home.
And as you heard, the goal is to try and keep them alive as long as possible, trying to give their bodies a chance to fight off this virus. And doctors say that they'll use any means available, any means that you might find in a regular ICU, including and up to respirators. Clarice?
Extreme details involved in that film. Now, we know that there are other Americans doing humanitarian work where the epidemic has spread. They're going to be coming home for safety reasons. Do we know anything about how they're going to be protected once they get back here?
We assume that there are going to be precautions taken for sure. We don't know if there's going to be any kind of quarantine system set up, or we don't know that yet. But doctors say that, you know, if you become infected, that the symptoms will likely show up within 48 hours to 3 weeks. Now, that's a long time span. But as you heard the doctor say, it's not something that you can get from casual contact, like sitting next to somebody. The real concern is, you know, if some of these patients, you know, become infected and then go home to their immediate families.
They could be at most risk. Phil, thank you.